Thank you for the invitation to tell you a little bit about pre-publication of image data in Canada and the US. And I'm going to focus on the more policy-based aspect of this, and then talk a little bit about what Bioimaging North America is doing to try to address some of the challenges. So the Government of Canada has a $573 million investment that they announced just recently for digital research infrastructure, so a strategy for the whole continuum of aspects. And this includes both data management and advanced research computing. I'm going to speak more about the data management side of things. The National Advanced Research Computing Initiatives are really focused on computational groups and so on, and are not set up for imaging. I'll also mention that I have quite a bit of information on my slides that with the interest of time I won't be able to go into, but I'm happy to share the slides afterwards. Okay, so the Canadian government has announced this investment, and then they've decided to put this under the umbrella of Research Data Canada. And they launched a new group called the New Digital Research Infrastructure Organization, which is a nonprofit that is meant to manage this investment and work directly with researchers to really develop the platform and the initiatives and the funding mechanisms to enable researchers to really access this digital research infrastructure and facilitate their work. So they're just starting an extensive period of consultation now, and setting up a researcher council, which will be made up of academic researchers from different fields. So as I mentioned, I'm focusing a little bit more on the policies that are out there for Canada and the US. So in Canada, we have 3 federal granting agencies for natural sciences and engineering, health research, and social science and humanities. And they have a shared policy on data management. And I won't go through all these bullet points, but just to highlight a few. The policy says data management is necessary at all stages of the project. It needs to be accompanied with high quality metadata, and it needs to be shared as early as possible in the process of generating the data and publishing it. And right now, bioinformatics, atomic and molecular coordinate data must be shared when it's published, but this requirement hasn't been extended to other fields yet. So they also have a nice definition of the different responsibilities of the different stakeholders, going from the researcher to the funders. And I'll just highlight a few here. So the researchers are responsible for data management practices across their project and implementation of those, and for staying abreast with the standards and expectations of their discipline. The research communities are to develop and promote data management standards and identify and promote high quality repositories. Institutions need to support the researchers so they can meet these best practices and develop them as needed, and assist them in developing data management plans for their research programs. And funders need to recognize that data is important for research output and bring that recognition to the community, and provide peer reviewers with clear assessment criteria for data management plans. So in the US, there's similar documentation. I'll just focus here on the National Institutes of Health, and they put out a draft policy in 2019 on data management and sharing, and they're just finishing up a public consultation, and final documentation should be available soon. And I think one of the important developments that came out of this is that researchers can request data management costs in their grant budgets. So this is, I think, a new direction for federal funding agencies in the US, and will give researchers, at least for project-based funding, some of the resources they need in order to actually share and deposit their data where others can see it. When I was doing my research for this presentation, I came across this publication that came out around the time of the draft policy from NIH, from a group of researchers in clinical trial research. And they bring up the point that we've been relying on investigators to voluntarily share data, but it hasn't really led to open science practices, at least not broadly across the community. So they talk about some of the shortcomings in the recommendations, and that they are recommendations and there's no mandatory aspect to it. There's no minimum standards that need to be followed, and no time frame for when data needs to be shared. And then, of course, the infrastructure and the tools in order to do this are needed. And one of the suggestions they make is to mandate sharing of clinical trial data as kind of a pilot project, just to see how this can be done well and done in cooperation with the NIH. And I think the COVID-19 clinical trials for vaccines is probably an area where this may be happening as we speak. So the idea would be that NIH would approve certain repositories and make people aware of them, use existing networks, such as the ones we're talking about during this meeting, to minimize the burden on the researchers to deal with the infrastructure and the actual implementation of data sharing, and then implement penalties if data is not shared. And the last point, which I think is one I'd like to highlight, something I think is really important for this community, is also that we need to reward data sharing. And they make the comment that researchers are typically reluctant to share their data because the incentive systems that we have built up in academic institutions are to reward individual achievement. And that we need to, in order to change that culture, we need to really reward data sharing and build it into the merit systems. So another group in the US is the Research Data Alliance, which is actually an international organization, but has an American outlet. And this group is building social and technical bridges to enable data sharing. It has a large membership across 145 countries, and it crosses all disciplines. So it goes from library sciences all the way to health sciences. And it's funded by private foundations, the NSF, and the National Institutes of Standards and Technology. So although this is a really broad-reaching group, it's also challenging to offer significant funding and resources that may be field-specific when trying to reach across all scientific fields. So just to kind of summarize what we have and what's missing is we have a lot of policies and guidelines. We have lists of responsibilities for the different stakeholders, and we know that much of the responsibility falls on the researchers to develop and implement data management plans. So what's really missing are the resources that researchers need in order to do this, and awareness in the research community of the necessity of sharing data and having good quality data. So one example, in Canada, we have national data storage initiatives, but they're limited to 1 terabyte per project. So as everybody here would know, in an imaging project, that's not gonna go very far. So there's sort of 2 areas there. We need the local expertise to implement data management plans and infrastructure, but we also need to create an awareness with the stakeholders of the storage needs for the bioimaging community, which is very different than for other communities like library science and even genomics and so on, is not really requiring the sheer volume of data that we have in bioimaging. And then, as I mentioned before, I really think changing the culture will really require rewarding data sharing and building it into the scientific merit system. So to wrap up, I want to discuss just 2 initiatives by the Bioimaging North America group to address some of these challenges. And this group is pretty new. We were formed just a couple of years ago, and the model we've taken is having working groups in order to bring more people in, build the community, and get things done. So in relation to data management, we have a quality control and data management work group, which is being headed up by Caterina Stramboy de Castilla, and she's in the meeting today. And some of the initiatives are to improve reproducibility, focus on quality control and data management, develop an international consensus, so working with the global community in order to come up with a consensus on how best to do things, and to disseminate this to the broader research community. And I'll just highlight one initiative. She has a comprehensive 5-tier metadata system that she's been working on in collaboration with the 4D Nucleome, where they're developing tier-based model for metadata for all components of light microscopy systems across many different modalities. And I just have one example there. I'm showing an objective lens going from sort of essential information that's needed to be in the metadata to things like a serial number that might be optional. And this is a really important initiative that I think will really help facilitate data sharing in bioimaging. And then I didn't talk a lot about image analysis, but we're also currently developing an image analysis working group, and Kevin Eliseri from our executive committee at BINA is heading that up. And we're recruiting a chair for that group and so on right now. And the idea will be to raise awareness about software resources that are available, run image analysis courses and workshops, and build international partnerships. And we're planning to model it after the NUBIUS or NUBIUS European initiative. And I'm happy to take any questions you might have. Thank you.